My name is Julie Cabinaw, and I'm a person with diabetes. I'm also a user experience director in real life, and so the intersection of how people behave and technology is not only a passion for me, it's something that plays into my personal life. Okay, so DiabetesMine has put down the challenge to patients and patient advocates to tell us what we would need to make living with diabetes easier. The first thing that would really help me is biometric device standardization. Blood glucose meters all use different strips, and they don't have a common standard for being able to connect them to the cloud or to my computer to share information. They come with clunky cords, and I have to figure out what kinds of strips I need to use, and those two things make it more complicated to use blood glucose meters. The second thing that would make life simpler is a personal health cloud, but I don't want you to call it my personal health cloud. I want my 80-year-old mother to be able to take advantage of the idea of her information being shared at her discretion to manage her control. The third thing that goes hand in hand with the cloud is control. Enable me to share the information that I wish to share with the people I want to share it with at the time I want to share it. The fourth thing is help me be a part of my care team, not be a subject of my care team. So if we have these great things, like data that's at our fingertips and data that we can share with our healthcare providers, it makes sense to make the systems and the processes for healthcare providers more supportive of them being proactive and including me as part of my care team. It's way too easy when all I do is see my doctor every 6 months and get that A1C measured and not have a lot of background data about what happened in those 6 months in between, that if a rise increases in my A1C, it becomes much more likely that I'm a suspect of what did I do wrong that my blood sugar is out of control. Whereas if my doctor were able to see that I was, eating the right things by the food I was tracking, I was getting exercise, I was taking my medications appropriately and monitoring my blood sugar, maybe it would be a much more positive conversation about what we need to do differently in order to counteract the changes that we're seeing. So again, those four things: biometric device standardization, personal health cloud that's simple, control of my healthcare data, and being a closer partner with my healthcare providers who has the tools and the processes to be more proactive are elements that I think would bring together all of the great tools that exist today to manage diabetes into a more complete solution for people with diabetes. I wish you luck in designing your solutions for this with the DiabetesMine Design Challenge, and I look forward to hearing about your proposed solutions.